Thank you so much for accepting my pitch for the Global Oral Health Conference in April 2016. As I mentioned in my earlier video, oral cancer is a serious disease. And the problem is that we don't have knowledgeable healthcare workers who can diagnose oral lesions that can possibly lead to oral cancer. When I did my study in Vietnam, 56.2% of the people were advanced stages of cancer at 3 and 4, and the morbidity was higher than 55%. Early diagnosis is what is needed. I went back to Vietnam at Christmas time and I went to the oncology hospital, and one man could hardly open his mouth and he said, "Come on." That means thank you in Vietnamese. He thanked me for, I'm hoping, to bring a future without oral cancer in our world. Well, my solution is this, is to develop a standard of practice model, and that would be brought about by the University of British Columbia Dental Hygiene Program, which is a collaboration of informational exchange with the National Hospital in Ho Chi Minh City. We would provide oral cancer screening education and cultural oral risk habit awareness to the primary health care providers and professionals there. The innovation is threefold. It would be innovative biannual dental hygiene seminars that would teach the primary health care providers in the National Hospital. The travel costs for the healthcare personnel would be for rotation and practicum to examine, diagnose, and to treat cases at the National Hospital with the experts, as well as the third part would be for international exchange information. It's based on evidence. The study that I did, the research that I won that World Oral Health Hygiene Research Award, was from 2005 to 2010. There was a comparison of the last 5, 10, and 15 years, and there's been no change in diagnosis and no change in morbidity. In fact, prescriptions were given for vitamins and antibiotics, which of course we know won't do anything for cancer. So further research is needed. The core of the Vietnamese oral cancer educational capacity needs to be strengthened, and I believe that's with global health informational exchange. Well, it's all locally developed and locally responsible. The collaborators are Dr. Chan in the National Hospital, he's the director. Dr. Hai, he's the vice director at the National Hospital. Dr. Hum, she is the oral pathologist. And the collaboration has been for over 10 years that we've had. We need preventive education of healthcare providers with an international health knowledge exchange. And it's a responsible design that is recommended by both parties. The outcome measurements would be an evaluation of 1, 3, and 5 years to see what the stages of oral cancer diagnosis actually is, and to evaluate that. There would be an increase of early diagnosis, I'm hoping, a decrease in the numbers of oral cancer. And therefore, we'd also have an increase in the economy of the country as the morbidity goes down and the working age population goes up. There's a decrease in advanced oral cancer diagnosis, and this is in association with the increase in oral healthcare education of the primary healthcare professionals. Well, my expected impact is for long-term research and early diagnosis of oral cancer and saving lives. The team includes Dr. Hai, who is the National Hospital Vice Dean, and he is representative of the Ministry of Health. Dr. Hom, she's the head of the oral cancer pathology as well as at the university. Myself, who is a clinical instructor at the University of British Columbia and a UBC alumni, who I will lead the educational team from the University of British Columbia. If the monetary prize would be given, the budget would be this: for research, for equipment, for on-ground expenses, and for the travel expenses of the educational teams back and forth. The stage of the idea has been in place because the partnership is in place for many years now. In fact, the research and educational facility is called the Vietnam UBC Oral Health Research Center, and it's on the 4th floor of the National Hospital. It's a beautiful place, and it's funded by UBC alumni in 2012. However, there's no ongoing direction. My hope is that with funding, we will increase the scale of the use of this beautiful facility, increase the collaboration and the knowledge exchange. In fact, dental hygienists can take this task with force. We can make an imprint globally in oral cancer prevention and share this research globally. Thank you.